low vitamin D is associated with more health problems and a shorter lifespan. But like you launched the conversation, healthy vitamin D levels have been shown to increase the health of sperm, the health of eggs, increase healthy pregnancy rates. It protects our heart, it calms inflammation levels, it helps our metabolism.
Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey everyone, my name's Sarah Clark, and my mission is to inspire, motivate, and empower you. Most of all, I want you to wake up. With functional medicine, we can discover what causes infertility and eventually reverse the condition. Today, I'm welcoming Dr. Will Cole to the podcast, and we're digging into how vitamin D impacts your fertility. Dr. Will Cole is a leading functional medicine practitioner, specializes in clinically investigating underlying factors and customizing health programs for chronic conditions such as thyroid issues, autoimmune, hormonal dysfunctions, and more. He consults locally in the Pittsburgh area as well as by webcam and phone consultations for people across the country and around the world. Dr. Cole is a health writer for international publications such as Mind, Body, Green and lectures nationally. He's also the author of the forthcoming book, Ketotarian, in which he melds the most powerful benefits of a ketogenic diet with a plant-based one. Definitely check his website out at drwillcole.com, drwillcole.com. And before we jump into today's show, don't forget to hit the subscribe button on iTunes or wherever you're listening to this to make sure you never miss an episode. Hey, Dr. Cole, excited to have you on the podcast today.
Thanks so much for having me.
Awesome. Yeah, if you could share your journey as to how you came to do this work.
Yeah, so I'm a functional medicine practitioner, and I kind of live and breathe what I do. I love what I do. I get to spend most of my week seeing patients. Most of my patients are seen in other states and countries. We're primarily a virtual functional medicine practice where we're based in Pittsburgh, though. And my journey kind of started a long time ago, relatively speaking. I always knew I wanted to be in wellness. I grew up in a family that kind of respected wellness, was interested in wellness, and I saw what that could do to one's health and the impact that food and natural medicines and lifestyle choices could have on one's health. So I had gone to an integrative school, so sort of this kind of mecca of different ways of healing. There's traditional, conventional MDs or doctors of chiropractic, naturopaths, nurse practitioners, acupuncture, oriental medicine, all at Southern California University of Health Sciences. And I had heard of a guy called Tatis Karazian who had gone to my school, was older than I was, and he was talking about this thing called functional medicine. And I thought, okay, well, what is that? And I kind of learned about it. And it's sort of this cool hybrid of the best of Western medicine, which is being evidence-based, being objective, running labs, and then the best of alternative health, which is actually getting somebody healthy and not just prescribing medications and see you later in 6 months. So I loved it, and I kind of immersed myself in it, applied the sort of functional medicine tools in my own life, in my family's life. Now I'm just constantly in awe of the fact that I get to talk to people all around the world about this and be a part of their wellness journey, which is sacred. I take that responsibility tremendously seriously, and I love what I do.
Awesome. I love it. Yeah. So for this podcast, we're going to be digging into vitamin D and sort of why it's important for egg and sperm health. Could you share a little bit about vitamin D to start with for us?
Sure. So there are only real two different hormones, and vitamin D is sort of a pro-hormone when it comes to how it acts. And there's only the thyroid and vitamin D are like the queen and king, respectively, of all hormones. Every cell of your body needs them to function. Every cell of our body has a vitamin D receptor site and it has a thyroid receptor site. No other hormone, no other pro-hormone has that level, that gravity of importance. So that is definitely uber important because every cell of our body needs it, but it's also widely deficient. Many people are deficient in vitamin D. And again, because most of my patients are not in sort of the Northeast where I'm located, I see people closer to the equator, people that are outside for work, like they're like construction workers, or they they're gardeners or something like this, and even they are vitamin D deficient, living near the equator, working outside. So let alone the person that lives in Seattle and it's rainy all the time and they have a desk job. Vitamin D deficiency is widely pervasive. So it's needed not just, it's needed for many things. There's over like 2,000 different genetic pathways that are responsible in part and require vitamin D to function properly. So yes, it's something that it's like an essential functional medicine thing that we look at when it comes to one's wellness.
Okay. And obviously then tying into the egg health and sperm health is essential for that as well. Yeah.
Oh yes, you're right. Absolutely. Our sex hormones, sperm production, egg production, and egg health require vitamin D. And not just vitamin D. When we're talking about vitamin D, and I think that's a good launching pad, all fat-soluble vitamins, of which vitamin D is one of them. But I would say vitamin K2 is also very deficient. That is found in foods and works synergistic with vitamin D and vitamin A and vitamin E. So these are all fat-soluble vitamins and things that we look at in functional medicine. But vitamin D is certainly the most well-known and very common to be deficient.
Okay. As far as functional levels, what are the functional levels for vitamin D for
so the functional range, and that's an important kind of part to highlight here, is that the functional range is where your body is functioning the best. If you take people with health problems out of the lab's reference range, what's left is typically a tighter range within the larger reference range of where the lowest risk factors are associated with. People are living the longest, healthiest, vibrant, thriving life. That their body, and the biomarkers on their lab are living and residing within this functional range. And that's what we look at in functional medicine. So for vitamin D, the functional range, the optimal range is 60 to 80. And you'll typically see on a lab reference range about 20 to 100. So that's a big range. But that's just looking like all the other biomarkers at a statistical bell curve average of people who go to labs. People that go to labs aren't the healthiest bunch of people. So I want to look at the labs reference range to put it in context, but I also want to compare any one of my patients to optimal health to get them there. And that's what I'm comparing them to as the benchmark for being healthy.
Okay. So the functional range is 60 to 80. The conventional range did you say 20 to 100?
Yeah. And that may vary from lab to labs as they often do, but you're going to have a bigger range, whatever that is.
Mm-hmm. That's what a lot of people are told, that theirs is maybe, it could be low, but if you're looking at a functional medicine, it would be really low.
Absolutely. Right. Or there's people that are, they're supplementing with maybe like a 500 IU or 1,000 IU of vitamin D or even 2,000, and they're doing the right thing. They're trying to do the right thing and they're supplementing with it, but their vitamin D is just not going to get to the optimal range with that lower doses of vitamin D. And I think that's why it's important to get your vitamin D tested pretty consistently a couple times a year, especially if you're supplementing, to make sure that you're in that sweet spot, that functional range, and not going too high either, which isn't good. But more oftentimes than not, it's too low as being the issue.
Yeah, and a lot of women that come to see us that are struggling with infertility, they have very low vitamin D. So what could this mean?
When someone has low vitamin D?
Yes.
Yeah. So, it's associated because it's responsible for thousands of different genetic pathways and sort of biochemical processes. It could be associated with anything. As a general umbrella, it's associated, like low vitamin D is associated with more health problems and a shorter lifespan. But like you launched the conversation, healthy vitamin D levels have been shown to increase the health of sperm, the health of eggs, increase healthy pregnancy rates. It protects our heart. It calms inflammation levels. It helps our metabolism. It helps strong bones, obviously. It boosts our brain. It helps our immune system. It reduces asthma, other autoimmune problems. Autoimmune conditions are associated with low vitamin D, and same with this type 2 diabetes. Helps with depression. It's so many things because every cell of our body needs it.
And I think we've just been told all along. I remember back in the day, Oprah did a thing years and years ago saying everyone should be supplementing with vitamin D because if you're north of the equator, we all need it. But then there could be other reasons. Okay, obviously our soil has been depleted and things like that, but there could be other reasons why our vitamin D is low. And it's interesting that obviously people that I work with, they're all dealing with infertility, and we don't necessarily just look at the infertility diagnosis. It's all the other things going on and looking at the person holistically. So yeah, as you say, it's got all these different autoimmune potentially, and we'll get into sort of gut infections and things like that. But it's usually a clue, and just supplementing may not get to the root cause of why, I guess.
Right. Yeah. And sometimes there's gut problems where their body's not absorbing nutrients. They're taking in good nutrient dense foods. They are maybe even supplementing with vitamin D, but there's a gut problem that they're not absorbing things properly. And there are genetic mutations like specific methylation genetic impairments, which are associated with trouble conceiving and trouble having a healthy pregnancy. But one of the genes is the VDR gene, which is the vitamin D receptor gene that makes the vitamin D receptor site. So if someone has a heterozygous, meaning a 1 mutation, or a homozygous 2 mutations, that's a number one of these VDR genes, they are genetically speaking not able to absorb vitamin D or make the most out of it as readily as somebody without those gene mutations. But to put that in context, I mean, our genetics haven't changed in 10,000 years. So those genetic mutations would have been there for a long time. So yes, genetics is a component to vitamin D and other things, but their epigenetics is by far more influential and more are associated with being more of the issue, not genetics. So the epigenetics are the lifestyle, the things we're doing in our life that influence genetic expression, but also determine our health or lack thereof.
Yeah, that turn on or off disease. Yeah. And so someone could have this VDR gene, which I guess they can get tested. Do you recommend 23andMe, or where do you do the testing for?
Yeah, typically I do 23andMe. I just download raw genetic data, and then I use there's like a Genetic Genie or Prometheus or a number one of these software programs, online programs that you can get the report.
But that wouldn't be the first step. That would that's kind of down the road. Okay.
Yeah. The first step is get your vitamin D tested, see where it's at, make sure it's between 60 and 80. That's where I would start.
Okay, cool. And so then you talked about at the beginning the importance of the thyroid and then the connection with low vitamin D. Could you maybe elaborate on that for us?
Yeah. So vitamin D is needed for healthy hormones, but it's associated specifically, and I would say a few different ways. The thyroid and vitamin D are both needed for every cell of our body to function, but also vitamin D and other fat-soluble vitamins are needed for healthy thyroid production itself, and different B vitamins, obviously water-soluble vitamins. And I would say that another connection there too is if your thyroid's not working well, nothing's working well. And if your whole metabolism's kind of sluggishly low, you're not going to make the most of the foods or the supplements you're having too. So I do find that people with hormonal issues or maybe fertility issues, yes, nutrients like vitamin D, vitamin K2, vitamin A should be looked at and optimized, but also hormone production like the thyroid should be looked at too. And you can't just base thyroid health on just the TSH, just the thyroid stimulating hormone. And that's typically the only lab that they run, and maybe a T4. So asking for a full thyroid panel, running a full T4, T3, total and free, and running thyroid antibodies, so thyroid peroxidase antibody and thyroid binding globulin antibody to look for Hashimoto's or an autoimmune thyroid issue, or Graves' disease with TSI antibodies. So I would look at a full thyroid panel specifically when it comes to optimal hormone health.
And what's your take on I think some endocrinologists, if there is some antibodies, may not necessarily say you have an autoimmune condition. What's your take if there's any antibodies present?
So it is normal in certain times to have some antibodies present, and it's sort of just immune system's regulatory system. The criterion for diagnose somebody with Hashimoto's disease is that you have to have a high TSH, above 4.5, and then both positive antibodies, the TPO and the TGA. Now, what I'm less concerned with, let's talk about when diseases are then labeled, because I know not just with Hashimoto's disease, but with any autoimmune disease, the health problems begin prior to the diagnosis. So we can split hairs and talk semantics of like, well, is this technically Hashimoto's disease? Well, maybe it's not by the governing bodies that say, well, this is when we label it with an ICD-10 code and call it Hashimoto's disease. I'm not that concerned with that. Yes, I am concerned with it in the standpoint of we want to educate our patients and inform them what's going on. But I'm more concerned with how the patient's feeling and the risk factors associated with problems. And on average, 10 years prior to the diagnosis of an autoimmune disease are when these things start to begin. So that's a whole decade. I don't want to wait till the immune system's destroyed enough of it to then call it Hashimoto's disease or MS or Parkinson's or any other autoimmune condition. What can we do today in the here and now to mitigate the risk factors, to dampen the immune attack against the thyroid or whatever else the immune system is destroying? So there are definitely subclinical autoimmune reactivity cases against the thyroid that I see a lot, meaning that TSH isn't above 4.5. They have slightly higher antibodies, or maybe one will be really high, but the other one will be negative. Like a TPO will be high, but the TGA will be negative. So for all intents and purposes, to be a strict clinician, that wouldn't be classically Hashimoto's disease, but that is autoimmune attack against the thyroid. That is autoimmune reactivity against the thyroid. And their TSH typically is not in the functional range. They're not outside of the lab's reference range, but they are like the functional range for TSH is 0.45 to 2. So you could have a TSH of 2.5, 3, 3.5, 4, 4.5. They'll say you're normal, right? But from a functional standpoint, that's outside of the functional range. That's a functional hypothyroid sort of case. So again, you want to put that in context. Is it there's an autoimmune component or not? And then what does the T4 and T3 free and total levels look like to get a full picture, a full context for what we're dealing with?
And a lot of people that come to us, there is a thyroid, there's the vitamin D, obviously, and then the thyroid potentially, then autoimmune too.
For sure. Yeah. It's
trying to get pregnant. Yeah.
Yeah. It's tough. It's difficult. You have to deal with these things. But I mean, these are the things that, I mean, in our world we're looking at, but many people, they're not really looking at these sort of nuanced components to hormone health.
And what about high cortisol or cortisol levels and low vitamin D connection? What are you seeing there?
Yeah. So I think when you have any nutrient deficiency, and vitamin D probably being the most important, that's going to put the body in a state of stress. And that's going to raise inflammation. Low vitamin D levels are associated with states of inflammation. So the body gets in the sort of sympathetic fight or flight mode. And you have what's called the brain adrenal axis, the hypothalamic pituitary adrenal axis. And then the body does what it's supposed to do. It's in a state of stress, fight or flight. It releases cortisol, and cortisol is an anti-inflammatory, and it's meant to sort of attenuate inflammation, and it's an immunosuppressant. So, and that's what inflammation is, a product, an aspect of our immune system. So the body's trying to regulate itself out by producing more cortisol, which works in the short term. But if there's this constant state of inflammation in this scenario, of this example of maybe a vitamin D deficiency as being a component or the entirety of that inflammation, then you're always going to have this vicious cycle of nutrient deficiency and the state of inflammation, and then this cortisol response, which stresses out the body long term even more, because what's called adrenal fatigue is really a brain-based issue. It's the HPA axis. But the HPA axis, I mean, you also have the hypothalamic pituitary ovarian axis, the HPO axis, and the brain thyroid axis, the HPT axis. So this brain endocrine hormonal communication line is really going to be inhibited or impacted negatively long-term with nutrient deficiencies. And again, vitamin D probably being the most important here.
So I guess the chicken and the egg there, like what comes as far as the cortisol, can then that contribute to low vitamin D, or how does that work?
Yeah, it definitely states of that vicious cycle, chicken or the egg. It probably depends on the person, what came first, and looking at their health history and asking a lot of questions and seeing what happened. And people want to know that. How did this happen? And I think that's certainly a valid thing to want to know. I mean, and I do my best to kind of go through what does the research say, and then how can that make sense to the individual when you look at all their labs. But I am more concerned with, okay, whatever happened first, we have to deal with all of these issues. This is where we're at in the here and now. And let's deal with more of the upstream issues and then the downstream impact of all of this. Yeah, it's a vicious cycle. What begat what, it probably depends on the person, but nutrient deficiencies and then subsequent hormonal imbalances, or hormonal imbalance and subsequent nutrient deficiencies, that kind of can go hand in hand.
Mm-hmm. And so because many people have heard of adrenal fatigue, which are now kind of, I guess, moving away from, and saying this, I guess, issue with HPA axis. Are you able to dig into that for a little bit, Chris?
Sure, yeah. So I still use the words in my articles and when I'm talking about it is adrenal fatigue, because that's what people are aware of. And I think it's a little bit more descriptive to the layperson, but I've always, from the beginning, for the past 10 years, brought about the fact that what we call adrenal fatigue is really not an adrenal problem. It's a kind of a poor nomenclature to really what's going on here. But it's descriptive for the average person that's reading or listening to a podcast. The cortisol is a hormone that our adrenal glands secrete, and cortisol is supposed to be higher in the morning to wake you up, and then this sort of nice circadian rhythm, this S-shaped curve throughout the day. Then cortisol is lower in the evening, or it's supposed to be, and that allows serotonin to be converted into melatonin and for us to get a good night's sleep. The cortisol, what we call adrenal fatigue, is really a lack of balance or a loss of balance of that brain-adrenal communication, the HPA axis. So cortisol can be high when it should be low, or low when it should be high. It could be always high or always low. So we typically run urine and saliva tests to kind of gauge HPA axis function, but also different cortisol metabolites and other hormones that can interplay with cortisol that kind of explain hormonally what's going on for that patient.
Are you running the Dutch test then? Are you?
Yeah.
Yeah. So do we.
Yeah.
Okay.
That's one of the best research. The cortisol awakening response has some good data to back it up.
Okay. And then we talked a little bit about this, about the autoimmune condition. So we talked about Hashimoto's. What else with autoimmune and low vitamin D? I think this is your specialty, autoimmune.
Yeah. I mean, autoimmune conditions definitely are, and people going through this are my heart and passion of being a support system for them and digging deep clinically to see what's going on and things that they can improve in their life to take back their health wherever they can. There's 50 million Americans with an autoimmune disease, and that's just they diagnose like autoimmune diseases. There are millions more somewhere on the autoimmune inflammation spectrum, meaning they have symptoms, but they're not really told why they're feeling the way that they do. There's 3 stages on the autoimmune inflammation spectrum. There's silent autoimmunity, meaning if you ran labs, you'd maybe catch something, but they're not noticing any problems. And then stage 2 is autoimmune reactivity, meaning you have symptoms, they don't feel well, but they're not bad enough to fit the full criterion of stage 3, or the autoimmune disease, where you're labeled with an ICD-10 code. There's over 100 different autoimmune disease, an additional 40 above the 100 that at least have an autoimmune component. So for maybe people listening out there, that's MS, Parkinson's, rheumatoid arthritis, Sjogren's, lupus, Hashimoto's disease, celiac, ulcerative colitis, Crohn's, and the list goes on and on. It impacts the brain, impacts the thyroid, impacts the joints, the gut, really every system in the body. You can have one autoimmune condition, meaning the immune system's attacking a certain set of tissues in the body, and then they'll call it that disease, or there's polyautoimmunity, meaning that there's more than one autoimmune condition. But on average, again, 10 years prior to the diagnosis is when these things start brewing. So there's a lot of people in stage 2, autoimmune reactivity, but they are told you just have chronic fatigue, you just have fibromyalgia, it looks autoimmune, basically come back to us when it's bad enough for us to put you on a steroid or an immunosuppressant biologic drug. And that's sort of this reactionary response in the West for people with autoimmune conditions, is that let's wait till the immune system's destroyed enough of it to then just shove the inflammation down with a steroid with tons of potential side effects, or a biologic with tons of potential side effects. And anybody on those medications will tell you it's really not this utopia, and they're still having health problems. Now, the criteria for diagnosis for a lot of these problems, a good example is Addison's disease, which is the autoimmune adrenal disease. It's not the same as HPA axis issues. It's not adrenal fatigue. It's an autoimmune disease that attacks the adrenal glands, so not producing enough cortisol, there has to be 90% destruction of the adrenal glands before it's bad enough for them to call it Addison's disease.
Oh.
That's pretty insane, but that's the criteria here. And that's similar numbers to MS and celiac disease. There's a significant amount of destruction from the immune system before they say, oh yeah, that's what that is. And then, okay, that didn't happen overnight. So what can we do now on that inflammation continuum to do what we can to improve our health? And that's really what I spend most of my work week doing.
Yeah. And so someone that's got an autoimmune disease, or maybe the symptoms that's not actually classified as that, I guess it's hard to say what that would look like if you're to catch it before, like in that 10-year window. And so, because people that are listening to this are struggling with infertility, and they could have something brewing along, not to say they do, but is there anything to look out for? Or like maybe there's a whole host of things to look out for.
Yeah, I think that's an important part. And I think this is a really nuanced conversation, and I maybe want to balance what I just said out with this sort of side of things, is that this is not meant to put fear into anybody or scare anybody. This is just to give them a sound mind to kind of know, okay, look, this is out there. I'm not saying you have it. I'm not saying anybody has it. I'm just saying this is the information. Inform yourself. That's a good thing. But stress is not good for your health either. And freaking out about something isn't good for your health. So it's just about doing our due diligence and being informed people. So with that said, if somebody has a family history of autoimmune conditions, that's something to think about. Like, okay, these are typically X chromosome linked. There's a genetic component to it. So was this triggered in me because I had the genetic predisposition? So that's something to think about. So the other things to think about is if you're being a compliant patient, if you're doing what your doctor is telling you to do, but you're not getting better, you're not seeing the results, then that, I think, an autoimmune component is worth testing for, because there's so many people with autoimmune reactivity that go undiagnosed. I think it's good to at least rule it out. And the only way you can rule it out is if you have it tested. So you can go to a functional medicine practitioner. We run these labs for people all over the place, but there are a lot of functional medicine practitioners that can do that. And measuring antibodies against ovarian tissue or against other endocrine tissues or against the thyroid. These are things you can have ran.
Okay. So looking at family history and then digging further with labs.
Yeah.
Okay. And is there any specific ones you'd look at there? So as far as the lab, we look at a blood chemistry review for our clients. As far as, I don't know, what are ones that you're specifically looking at?
For autoimmune specifically, I love Cyrax labs.
Okay.
Arishta Vijdani is one of the leading immunologists in this field. So running their predictive autoimmunity, they call it autoimmune reactivity screen. So it's not diagnosing somebody with an autoimmune disease. It's just measuring abnormal antibodies against certain tissues to understand the nuanced activity of the immune system and if it's attacking different systems of the body. So it's very helpful from a baseline screen of, is there an autoimmune component or not? And then from there, you could dig in a little bit more with some other labs, but I think that's a good starting point.
Okay, Cyrax. As far as, are you seeing the correlation then that the majority of people that have autoimmune condition potentially have low vitamin D? Is that a correlation to make, or?
Oh, absolutely. Yeah. I mean, low vitamin D is associated with autoimmune conditions. And again, go to your point, is it the chicken or the egg? It's probably a bit of both. I think when your body's in a state of stress, that then you're going to talk about pending problems with absorbing nutrients. But because the immune system needs vitamin D to be properly balanced, it's also part of the origin as well. But basically, vitamin D levels are associated with autoimmune conditions like MS, like Parkinson's, like type 1 diabetes, like inflammatory bowel issues like ulcerative colitis and Crohn's, and autoimmune thyroid issues like Hashimoto's and rheumatoid arthritis. And I would say conversely, optimal vitamin D levels are linked with symptom improvement of these autoimmune conditions. So it's a bit of both.
Okay. And then we talked about the gut a little bit in the beginning. So as far as pathogens and related to low vitamin D, so it may not necessarily be an autoimmune issue. It could be that you have a gut pathogen. We run a GI map looking at parasite and bacterial infections, fungal infections. So what's the correlation there with a gut infection like SIBO or Giardia or Candida or worms and low vitamin D?
Yeah. So your gut, our gut, all of our guts are 75% of the immune system. So you're dealing with autoimmune issues or other inflammatory issues that aren't autoimmune, they're just inflammatory. gut-centric or gut-originating inflammation is really common and widely underlooked at in conventional settings. So they say, we are what we eat, but we are what we assimilate. We are what we absorb. And you could be eating something and it's not absorbing properly. And I see a lot of people that in the short term, they maybe had this sort of health awakening. Their health wasn't doing so well. So they started eating clean, but their gut is not in the optimal state. So they're not even absorbing the nutrients. You run the nutrients and they're still deficient despite eating nutrient-dense foods and despite supplementing. So at that point, you need to kind of like go back to the basics of healing the gut, which takes time. It's definitely not a quick fix. But I think longer term, we need to help with, oftentimes we have to help people absorb nutrients appropriately. And then not just microbiome or gastrointestinal absorption, but also cellular absorption and the receptor sites to these certain nutrients. A lot of times like vitamin D receptor sites, thyroid receptor sites, or insulin receptor sites or leptin receptor sites. These are blunted because of chronic inflammation, because of oxidative stress, to start to get the sharpening of these hormonal and nutrient receptor sites to even get your body to absorb it on a cellular level as well.
And it's a place where when I have say that we look at, we do a stool test, and it's a place where people dealing with infertility in this case, it's just, they don't look as far as conventional medicine. Well, maybe that's the last place they're going to look to see if there's, and the number of people we find with parasites and worms and the like is kind of shocking. So, and then again, the correlation then with low vitamin D, which then affects the hormones. And
yeah, it's definitely true. And people think of these underlying gut problems like dysbiosis or SIBO or parasitic issues or yeast and fungal issues are like a third world, developing world problem. It's really not. It's around the West as well.
And do you have a protocol then how do you work with patients as far as when you're finding gut infections?
That depends on what the infection is and how many layers they have to it. But it's going to be a combination of different food interventions, different sort of biohacking, like advanced food protocols with maybe some intermittent fasting and natural medicine. So antimicrobials, anti-yeast and fungals, or anti-parasitics.
Yeah, and that's why I share with people to say, okay, if you were to take maybe this results to your conventional medical doctor, they may say do an anti-parasitic or an antifungal, which will then wipe out all the good bacteria, whereas we're going to do low and slow and do a more natural protocol. What's your discussion you have with your patients on?
Yeah, I say very similar things that you just said. I think that there's a time and place for it. If there's like an acute yeast infection or a parasitic thing that's causing severe symptoms, or like a severe bacterial infection, look, that's not my go-to. I think that you would start with like a pruning of the microbiome and not an atomic bomb. Yeah. Sometimes the atomic bomb is needed, but I think that more oftentimes than not, the atomic bomb causes a lot of relapses, meaning that it solves the problem in the short term, but they'll find their symptoms come back. And like you said, there's that loss of all the good bacteria, which can cause a whole host of other problems. So short term, it seems like great. Like anybody that's suffering just wants to get some relief. But long term, I find that it's not very effective for a lot of people. And there's research to show that a lot of these herbal antimicrobials are just as, if not more effective as the pharmaceuticals without the negative potential side effects of some of these antibiotics and other drugs.
Yeah, exactly. And the people that come to see us typically are in a panic to get pregnant because it doesn't matter how old they are. If they're 28, 38, everyone's past the time. And if we find something and then we say, look, you've got to spend X amount of months, maybe 4 to 5 months to work on this. And then but along that time, you're healing your gut, focusing on preconception health. It could seem, in the grand scheme of things, it's a short period of time, but how do you get people to kind of say, wait a minute, there's a little bit of patience involved in here, and to allow your body to heal?
Well, yeah, it's, I guess, creating a foundation, a relationship foundation first. And we function mainly as a sort of a concierge functional medicine practice where we're talking to them in between visits. So when they are having a rough day or they do feel discouraged, we can like say, hey, look, this is normal. This is normally you're feeling this way. It's going to take time. It didn't happen overnight. It's not going to heal. Having a support system and structure is hugely valuable, as you know. Mm-hmm. So I think as long as you're providing that support system and you're listening to the patient and validating what they're feeling and give them direction and clarity, that's all most people want.
Mm-hmm. Mm-hmm. Absolutely. Okay. And then as far as some foods that can help with low vitamin D, I know you've got a book coming out on the keto diet. So, and you've got your take on it. What are some foods that you would recommend?
Yeah. So as anybody in functional medicine will tell you, we're all different and there's not a one diet that fits all. But within a paradigm of any one way of eating, if you look at the paleo diet or a vegan diet or Mediterranean diet, it's about, can you personalize the food choices and find the foods that make you feel great? So over the past 10 years, I've seen what works, what doesn't for a lot of people. And I try to boil it down to sort of a fresh way of eating that I think could be a great sort of food journey to use food as medicine in a new way. And that's why I wrote Ketotarian, which is a plant-based ketogenic book where it's sort of this. Yeah, it's sort of an alchemy of the best of plant-based and the best of keto, hence the name Ketotarian, sort of play on keto and vegetarian, where it's predominantly plant-based. The cover says mostly plant-based because there's vegan keto options, there's vegetarian keto options, and there's pescatarian keto options, or what I call vegetarian, this wild-caught fish and shellfish. So look, I mean, they can do just vegan keto, or they can do a mix of vegan, vegetarian, and pescatarian, depending on what their preference are, or their religious or ethical convictions. They can do one or all of them. And I love it. So it's like this 8-week keto rehab, like metabolic rehab, to kind of shift the body from being a sugar burner to a fat burner. And then they're in ketosis, they're fat burning, the ketones are providing anti-inflammatory benefits because beta-hydroxybutyrate, the main ketone that is produced during a healthy ketogenic diet, is anti-inflammatory. And it's also good. It can pass through the blood-brain barrier and be brain fuel, and you can be sharp cognitively, so it decreases brain fog and other brain issues. And it's just good for mitochondrial function too. So from a cellular energy, it increases mitochondrial biogenesis. So it has a lot of cool clinical applications that I love, that people can see have real life health changes in their life. They can notice improvements in their health. So do that for 8 weeks. And then after that, they can decide what they want to do. They can stay in ketosis because they feel so great, or they can play around with macros. And we talk about finding your carb sweet spot, because some people can do fine with certain times of higher carbs, like maybe extra sweet potatoes or a smoothie, and they do fine there. And then they can go back to ketosis because they built the metabolic flexibility that those 8 weeks of ketosis brought them. And then some people can bring in some grass-fed beef if they want to, or they can stay completely plant-based or just with the wild-caught fish. So it allows that customizable functional medicine. We're all unique aspect of it, but the 8 weeks allows that metabolic overhaul that I really wanted to get across from being plant-based keto.
And as far as the intermittent fasting and hormones, is there a little criticism about that it may not be right for people struggling with infertility? But I think you probably have a different take on that.
Yeah, I do have a different take on that. And I just devoted a whole section of a chapter to that, is intermittent fasting and female hormones and thyroid hormones and cortisol and all that stuff, and the impact that intermittent fasting and ketosis have on our hormones. One of the main enemies of hormones is inflammation. So we're saying 8 weeks, let's calm inflammation levels down. Let's get the body becoming a sort of clean burning, fat burning machine, which healthy fats, which is what we're focusing on, healthy plant fats and omega fats in Ketotarian, that is like hormone food. And you talk about vitamin D, I mean, that's in fish, that's in egg yolks, that's in these foods. We're talking about nutrient dense foods to help with healthy hormones. And then times of intermittent fasting helps to, again, increase autophagy, which is cellular repair, which is good for our hormones. So I think the problem isn't, let's make blanket sweeping statements and say intermittent fasting is bad for hormones or ketosis is bad for hormones. It's like, okay, well, maybe it's just for the individual, since we're all different. Some people, I see it all the time, people do too much too soon, and they're not leaning into things and finding their own groove, finding their own sweet spot. So you don't throw the baby out with the bathwater and say, well, it's all bad because it didn't work for me. It's about how do you tweak it for you. And there's a lot of nuance within those umbrellas of being plant-based keto or any diet. And you have to find your own personal rhythm there.
Yeah, plant-based keto. That's pretty cool. As I didn't realize that's what it was because I've interviewed someone else podcast about the ketogenic diet and which she's saying it's basically the paleo diet on steroids, which is like tons of like a lot of meat. And I'm I'm gluten-free, dairy-free, and corn-free, but people keep thinking I'm vegan. I'm like, I'm not vegan, but I'll do fish and chicken but yeah, I feel happier with more plants. So
Yeah, you would love this. You would love it. I mean, half of the book is like health science and like made fun and quirky and easy to understand for the layperson and the practitioner. And then half of the book is like pretty pictures and recipes and meal plans and how to do it. And I'm super pumped about it. I've been working on this like day in, day out for the past year, and I'm excited to get it out to the world.
Love it. I love it. And as far as we touched on this a little bit here about supplementing with vitamin D, what does that look like? And I guess usually being under under your doctor's care for this.
Yeah, if someone's doing a lower amount of it, I don't know if you need to be under a doctor's care. I think you need your doctor to run your vitamin D or run your own vitamin D online to gauge it. But most people are seeing their PCP at least once or twice a year. And vitamin D is a pretty basic lab you can have them run. And most doctors won't have a problem with running the vitamin D. So vitamin D that we use, and we have it on our website, it's a blend of vitamin D3 and K2, which is sort of synergistic impact that K2 has with vitamin D, which vitamin K2 is super important for all those things we talked about with vitamin D. K2 is really important for the immune system and our hormones and brain as well. So that's why we paired vitamin D3 with K2.
Okay. And you talk about the Goldilocks principle with vitamin D?
Oh, yeah. It's got Goldilocks principle, not too high, not too low, just right. We want it 60-80. And pairing it with K2 can prevent toxicity as well because it's this synergistic impact, more of like a real foods combination of having the K2 with the D3.
And so the same issue with too low, and then you've got issues with too much if people have over supplemented. Is that kind of what you're seeing? Or
oh yeah, if they're too high, it's from supplementation. They're not getting too high from like being out in the sun too long. It's from supplementing.
Mm-hmm. And then obviously the tried and true, they're getting more sun exposure to help improve your vitamin D levels. What about sunscreen?
Well, we need the sunlight to make vitamin D. We need cholesterol to make vitamin D. So healthy fats and some dietary cholesterol and the cholesterol that our liver produces, that's needed for healthy vitamin D, but also pairing that with sunlight. So depending on where you live and your skin tone and your health history, and around 20 minutes in the sun a day when it's sunny out. But I mean, I'm in the Northeast. It's not sunny year round. So that's why supplementing is important for optimal vitamin D levels and for most people. And I would say sunscreen specifically, I use sunscreen, but it's a natural sunscreen, non-toxic. So read the labels. The Environmental Working Group, EWG, has amazing sunscreen campaign and all cosmetic campaigns, Skin Deep, where you can vet what you're using on your skin because our skin is our largest organ. So if it's not from the earth, if it's not pretty dang natural, if you can't eat it, I don't think you should be putting most of the stuff on your skin because what you're putting in your skin, your body's eating. So it's important to get a non-toxic, natural, organic sunscreen.
Love it. Absolutely. And as far as a success story you'd like to share with us, with anyone you've worked with? Yeah.
All right. So there's a lot. We put a lot of them on the website because people want to share their story. But one lady I'm thinking about this was years ago, but it's stuck in my mind because the words she said was very poignant. She had multiple autoimmune reactivity issues. She came in a wheelchair, her husband pushed her in. She was very sick, had tons of problems and not on tons of medications, but she tried them all. She was a very compliant patient with her conventional doctor, but she still was struggling with her health problems. And we found a lot of things going on in her gut. We found a lot of things going on as far as toxicity, viral infections. We found nutrient deficiencies, a lot of problems. So it wasn't just one thing, it wasn't this magic bullet, but we dealt with a lot of these problems over the course of, she was with us for about a year. Over that year, you started seeing this person that had no really little life in her start regaining function. She was able to walk with a cane, then didn't walk with a cane, and she had more energy and she could do things. And we were tracking all of her goals, her health goals, and we started seeing the frequency and the severity of these flares go down over that course of that year. And why I bring her up is that her doctor said there's nothing that can be done, and this is basically her lot in life, and the best she could do is manage her symptoms. And the sentence that she said was very powerful. She said, "I was planning my funeral when I met you. Now I'm planning vacations with my children."
Wow.
And that to me was like, whoa, that is a huge shift. Because then you think about all the people that are planning their funerals, that are told there's nothing wrong with them, and do not realize they have any other option.
Yeah.
So that's like what motivates me. Stories like that every day.
I love it. It's amazing. I remember Terry Walls, who the Walls protocol, and was in a wheelchair and then with MS, and now walks around freely after making all these changes.
Yeah, Terry's a good friend of mine, and she's just a brilliant, sweet lady. And I speak at her event every summer. Yeah, she's another testimony of just real life. And going to her event actually every year in August. It's in Iowa. Anybody who is listening should go, because it's for the practitioner, but it's also for the layperson. Most of them are just lay people, not just with MS, but with any type of random health problem. It's so inspiring to see people going through this. It's not just Terry Walls. It's a lot of people out there. And it's really encouraging to kind of see what is possible.
Awesome. So you have a free download for our audience here called Heal Your Autoimmune Condition. Can you share a little bit about that, what they can expect?
Yeah, so it's a functional medicine guide to immune health and sort of the things to look for on labs, what to test for, maybe what to look into for yourself, to educate yourself. And yeah, so you can go to drwillcole.com for all of that stuff and just subscribe on the homepage and we can get you that. And there's a lot of video classes and other additional content for you to sink your teeth into if you want to learn more. Awesome.
And your new book is coming out. Can you share a little bit more about that for us?
Yeah, so it's on pre-order now, comes out August 28th. And depending on when you're listening to this, that'll be out, or it's on pre-order now with a lot of free stuff for pre-order. You get instant downloads for different guides that are in the book, additional recipes that aren't in the book, and you're going to love it. It's on Amazon, Barnes & Noble, IndieBound, all of that stuff.
And that's called the Ketotarian, Mostly Plant-Based Cravings and Inflammation?
Yep, Ketotarian.
Awesome. Amazing. Well, thanks, Dr. Cole, so much for coming on the show today and sharing your words of wisdom. I really appreciate it. And have yourself a fabulous day.
You too. Thanks for having me.
Hey there, Sarah Clark here. So are you struggling to have your baby? First of all, please know that my heart goes out to you. I support couples worldwide who are struggling with infertility to conceive and have healthy babies. Women like Rita, who gave birth to her beautiful daughter after following my fertility coaching system. Or Danielle, who after 2 failed IUIs was able to get pregnant after a Supercharge Your Fertility Discovery call with me. So here's how you get my help for free. So I offer a free Supercharge Your Fertility Discovery call, and on that call, I'll create a plan with you that is going to help you fast track your success. So this call is not for everyone, and I'm really picky about who I get to speak with. And I have a strict but totally reasonable criteria that needs to be met in order for us to move forward. So here's who I can help. So first of all, you need to be able to explore your infertility diagnosis in a new light. So this offers for people who are open-minded, they're coachable, and if you can do that and want to double or triple your chances at the fertility clinic or get pregnant, awesome. So let's get on the phone and chat. Also, you must be an action taker. So someone who's committed to seeing results, you're able to follow directions. Don't worry, I'm not going to ask you to do anything bizarre. But if you're one of those people who like to consume a ton of information, but don't like to spend time implementing and seeing results, then the call's not really for you. So I only want to spend time with people who are genuinely committed to their own success. So just click on the link in the show notes and apply, or go to fabfertile.com and click on the free consult. So it's a really short application that just tells me about your health, how long you've been trying to conceive, and how soon you'd like to be pregnant. So seriously, this is going to be the best time you've ever spent on your fertility. Looking forward to chatting. Talk soon. Thank you for listening to Get Pregnant Naturally. Seriously, it means the world to me that you're here. Make sure you hit the subscribe button so you can be notified of upcoming episodes. I'm excited to offer you a special gift. If you're a U.S. resident, text FERTIL to 345-345. You'll be prompted to enter your email address and you'll receive our Fertility Yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to your heart. These simple fertility yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. So for U.S. residents, text FERTILE, F-E-R-T-I-L-E, to 345-345. For non-U.S. residents, go to www.yogafreebie.com to access your special gift. That's www.yogafreebie.com to access the free fertility yoga download. And I love this quote by Dr. Mark Hyman, medical director of the Cleveland Clinic Center for Functional Medicine and chairman of the Institute for Functional Medicine. Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't in fact treat disease. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. Thanks for listening. Until next time.